Influenza-like illnesses are common during rainy season. Joining us via Zoom is Dr. Daisy Tagarda from the Philippine Society for Microbiology and Infectious Diseases. Good morning, Doc.
Good morning, Paolo. Good morning to everyone watching your show.
Doc, obviously we just are still recovering from Christine, and there's also the possibility of Typhoon Leon coming in. At the same time though, with the rains, with this type of weather, nakita po natin that there's types of illnesses that do come about, especially influenza-like illnesses. For those wondering po, ano po mga common causes and symptoms of influenza-like illnesses?
Actually, the term influenza-like illness is a broad term. It has a lot of possible diseases, but the most common, it could be flu. Flu is caused by a viral infection with symptoms of fever, body pains, colds, and cough. So these are the symptoms of flu. COVID's still there, so we still see cases of COVID with also influenza-like illnesses like fever, cough, difficulty of breathing if there's pneumonia, headache. And then dengue is one of the most common causes also of fever during rainy season, especially because there are a lot of breeding sites for the mosquito, which is the vector of dengue. So they present with fever, body pains, abdominal pain, vomiting. So it depends on the degree and classification of dengue. So these are the common illnesses. So let me also mention the leptospirosis. Although this is not a typical influenza-like illness, this may also cause fever, body pains, but for severe types, they may present with jaundice or yellowish of the skin, and sclera or the eyes becomes yellowish. So these are the common influenza-like illnesses during rainy season.
Doc, we've seen it all over the news, people swimming in floodwaters. We've seen the rise in cases in terms of dengue as well. Are these the most prevalent diseases during any rainy period?
Yes, specifically for tropical countries like Philippines, the one that can explain that is because the breeding sites, which are usually water in urban areas like Manila, National Capital Region, there is an increasing number of vectors, which then increases the cases of dengue. So aside from that, there are also cases of diarrhea or typhoid fever because of the contaminated food and water due to the rainy season.
In terms of prevention and management, what would you suggest, especially we all know that there are some times napakahirap talaga, especially with the rising floodwaters?
Well, it depends on, there are different ways on how to prevent, depends on the type of the disease. So for example, for leptospirosis, still the best way to prevent the infection is to prevent wading in the floodwaters. If that's inevitable, we need to wear protective gears like boots. At the same time, for dengue, we have to apply mosquito repellents from time to time because the vector carries the virus, so that causes dengue. At the same time, we have to make sure that we practice proper hygiene because contaminated food and water can cause diarrhea and typhoid fever. So these are just simple ways on how to prevent diseases that are associated with rainy season.
Doc, you mentioned a while ago COVID cases. Do we have any update on the COVID cases and how are they managed, especially right now? It feels like it's a thing of the past, feels like at the very least. And of course, in terms of quarantine, other health protocols, are there other things that we still have to watch out for?
Okay, COVID right now, significantly, there's a decrease in number of severe cases compared before. I think there is something to do with the vaccination. Most of the people, Filipinos, are already vaccinated. That's why for our COVID cases, seldom that they require hospitalization. For the quarantine, we still recommend quarantine for those who turned out positive for 5 to 7 days from the day one of symptoms. On how we can prevent that, of course, wearing mask if you have symptoms, for example, cough and colds, and then you isolate yourself if you have flu-like illnesses, symptoms. So better to avoid exposing yourself if you already have symptoms. But in terms of management, there's not so much new about it. We still have recommend antivirals for selected cases of COVID.
Doc, you mentioned it a while ago, vaccines in general, that it has helped lessen the cases in terms of COVID. But at the same time, Ren, there are still a few people wary about vaccines considering the dengue vaccine, Dengvaxia controversy in the past. And at the same time, people who are reluctant. Do we still see people availing of vaccines despite we're already past the pandemic and despite any fears that people have had with regards to vaccines in the past?
Well, Dengvaxia is not already available in the Philippines, I think because of the controversy, but still available in other countries like Singapore and other tropical countries. They still avail Dengvaxia with some important requirements before receiving the vaccine. So I think we're going to have another dengue vaccine in the future. There's still ongoing research and study about the next dengue vaccine that will be introduced in the Philippines. So Dengvaxia is still available in other countries, not available in the Philippines. That's why we cannot recommend that in our country anymore. But we are open to some more researches regarding the uh, effectiveness of dengue vaccine in the Philippines.
Apart from, obviously during the rainy season and during wet and cold weather, flash floods that are commonplace, what's your advice for people, for the public, dealing with this type of weather, especially as the storms have been coming in fairly quicker?
Well, one of the things that are important to mention about the things that are happening with the storm, with the outbreak, is something to do with the climate change. But it is not when we actually become aware of the climate change, I think this storm, typhoon can be addressed, but it's not an instant if impact, no? So I think we have to increase awareness regarding climate change. At the same time, we have to increase awareness regarding outbreaks of different diseases like dengue, flu, typhoid fever, diarrhea. So increasing awareness at the same time, uh, preventing ourselves from exposing, for example, flood or those who are symptomatic with flu, then these are just simple ways on how we can prevent the diseases. At the same time, vaccine also is very effective. So if you haven't received your flu vaccine for this year, then probably you can consider getting the flu vaccine to avoid getting infected with flu.
Doc, right before we let you go, you mentioned vaccines once again. Is there any sort of reluctance to take any sort of vaccine, or has in general the Philippine public been medyo obedient naman when it comes to taking vaccines or at least inculcating themselves with vaccines?
Well, unfortunately, it still is a problem, no, in our country. There is decrease in vaccine confidence, but somehow improved because of the works that the healthcare workers do in raising awareness. So, in COVID-19 vaccine, at least, no, for the first two doses, there is a high compliance of vaccination. But in terms of booster, there's a significant drop with it. So one of the factors that affected the vaccine confidence is, of course, the infodemic and the misinformation that they get from the social media and other online informations that they can get. So I advise the public to at least validate the information that they read and that they watch from the social media like YouTube or Facebook, like that.
Doc, we really appreciate your time, and you're absolutely right. Tama, the word's compliance, not obedience, like the word I used a while ago. So thank you very much for all the information. Dr. Daisy Tagarda from the Philippine Society for Microbiology and Infectious Diseases. Maraming salamat po.
Thank you also.